Gentlemen, let me ask you something. When was the last time you woke up with a strong, confident morning erection? The kind that reminded you that your body still works, that you're still fully capable, still alive in every sense of the word? If you can't remember, or if it's been months or even years, what I'm about to share could change everything for you. Too simple. Ingredients sitting in your kitchen right now: extra virgin olive oil and baking soda, when blended together and applied correctly, can restore blood flow to your penis and wake up your little guy in as little as 24 to 48 hours. I'm Dr. Lila Romano, a board-certified urologist, and I've been helping men reclaim their vitality for over a decade. Today, I'm going to show you exactly how and why this works, the precise method to use it safely, and what results you can realistically expect. But here's what you need to understand right now. Your blood vessels are shrinking as we speak, and every day you delay makes recovery harder. So stay with me until the end, because by the time we're done, you'll have everything you need to take action tonight. Now, before we get into the solution, let's talk about what's really happening inside your body. The reason your erections have weakened has nothing to do with age or masculinity. It's about circulation. Inside your penis are microscopic arteries thinner than a grain of salt. These vessels deliver the rush of blood that creates an erection. When you were younger, they opened instantly, flooding the erectile tissue with blood. But over years of stress, inflammation, blood pressure medications, high blood sugar, and processed foods, these arteries narrow and stiffen. The smooth muscle surrounding them becomes less responsive. Even though your mind wants it and the desire is there, blood can't reach the tissue fast enough. I know the toll this takes, the confidence you've lost, the nights you reached for your partner and hoped only to feel your body fail you, the quiet distance growing in your relationship because intimacy has become fear instead of connection. I've sat across from men in their 60s and 70s who survived wars and built empires, and this one thing has brought them to their knees. But here's the truth most doctors never tell you. This is not permanent. Blood flow can be restored. Those arteries can be reopened. That tissue can be reawakened. And it doesn't require risky surgeries, expensive treatments, or lifetime dependency on pills with brutal side effects. What it requires is understanding how your body works and giving it the right tools to heal itself. Now, before I show you the method, I want you to understand that what I'm sharing isn't some internet myth. It's grounded in real science and over a decade of clinical experience. A study published in Nutrients in 2019 found that polyphenol in extra virgin olive oil significantly improve endothelial function, the inner lining of blood vessels responsible for producing nitric oxide. Nitric oxide is the master signal that tells arteries to relax and expand, allowing blood to rush into erectile tissue. Harvard Medical School research showed men who consumed olive oil regularly had up to 30% better erectile function compared to those who didn't. So let me show you exactly how this works, starting with the most powerful ingredient most men already have in their kitchen. Extra virgin olive oil is one of the most underrated natural tools for restoring erectile function. And once you understand what's happening at the cellular level, you'll see why. Olive oil is rich in powerful compounds called polyphenol, specifically hydroxytyrosol and oleuropein. These molecules do something extraordinary. They repair the endothelium, which is the delicate inner lining of your arteries. Think of the endothelium as the control center for blood flow. When it's healthy, it produces nitric oxide, the chemical signal that tells your blood vessels to open wide and let blood surge through. But when the endothelium becomes damaged from years of stress, poor diet, inflammation, or medication, nitric oxide production drops. The signal weakens. The vessels stay narrow, and erections fade. This is where olive oil steps in. The polyphenol and high-quality extra virgin olive oil actively repair that damaged lining. They reduce oxidative stress, calm inflammation, and restore the endothelium's ability to produce nitric oxide. It's like reopening highways that have been blocked for years. blood can finally flow freely again. And here's the part that shocks most men. This is the exact same biological pathway that Viagra targets. Viagra works by blocking an enzyme that breaks down nitric oxide, keeping it active longer so blood vessels stay open. Olive oil, on the other hand, helps your body produce more nitric oxide naturally. One is a temporary chemical override. The other is a foundational repair. But that's not all. Olive oil also helps stabilize testosterone levels by reducing systemic inflammation. Chronic inflammation is one of the silent killers of testosterone production. Because it stresses the Leydig cells in your testicles, the very cells responsible for making the hormone. By calming that inflammation, olive oil creates an environment where your body can maintain healthier testosterone levels naturally. More testosterone means more desire, more energy, more drive, all the things that make you feel like yourself again. Now, here's what you need to understand about quality, because not all olive oil is created equal. You need extra virgin olive oil, ideally cold-pressed and stored in a dark glass bottle. Look for a harvest date within the last 12 months. If the bottle doesn't have a harvest date, put it back. The polyphenol content degrades over time, so freshness matters. Brands I recommend include California Olive Ranch, Kirkland Signature Organic, and Cola Vida. These are widely available, affordable, and tested for quality. When you open the bottle, it should smell fresh, almost grassy, or peppery. If it smells stale or like crayons, it's rancid. Throw it out. Olive oil alone is powerful, but when you combine it with one unexpected ingredient, something happens that can trigger results far faster than olive oil by itself. And that ingredient is probably sitting in your pantry right now. I know what you're thinking. Baking soda? Really? The same thing I used to clean my coffee pot. Or bake cookies. Yes, and I understand the skepticism. But here's what you need to know. Baking soda, chemically known as sodium bicarbonate, has a unique ability to neutralize acidity, calm inflammation, and relax smooth muscle tissue. And all three of those functions are critical for restoring erectile function. Let me explain what's happening inside your body. Over the years, chronic stress, poor diet, lack of sleep, medications, and even normal aging create an acidic, inflammatory environment in your tissues. This acidity doesn't just affect your stomach or your joints. It affects the smooth muscle fibers that surround the tiny arteries inside your penis. When those muscles are inflamed and acidic, they stay contracted, tight, rigid. It's like trying to push water through a hose that's pinched shut. No matter how much pressure you apply, the water can't get through. Baking soda works by neutralizing that acidity. When applied to the skin, it begins to soothe surface irritation and reduce localized inflammation. But more importantly, it helps relax the smooth muscle tissue surrounding those microarteries. When the muscles relax, the grip loosens, the arteries widen, and blood can finally surge into the erectile chambers with the speed and pressure you need for a full, firm erection. This is why so many men describe feeling an almost immediate sensation when they use this method. A rising warmth, a tingling, a pulse they haven't felt in years. One patient told me it felt like someone flipped a switch inside his body, like the lights turned back on in a room that had been dark for a decade. And he's not alone. This isn't magic. It's physiology waking up from sleep. It's your body remembering what it's supposed to do when the obstacles are finally removed. But here's where it gets really interesting. Baking soda doesn't just work on its own. When you blend it with olive oil, the two create a synergy that amplifies the effect of both. The olive oil acts as a carrier, transporting the baking soda deeper into the tissue where it can work faster and more effectively. And that combination is what makes this method so powerful. So why does blending olive oil and baking soda together create results that can feel almost instant for some men? It comes down to absorption and penetration. When you apply baking soda alone, it works on the surface. But the real magic happens deeper, in smooth muscle and microarteries beneath skin. That's where erections are made or broken. To reach that depth, you need a carrier. Olive oil is lipophilic, attracted to fat. Your skin is made of lipid-rich cells, and olive oil passes through those layers easily. When you mix baking soda into olive oil, the oil becomes a transport vehicle carrying sodium bicarbonate deeper into tissue. Simultaneously, polyphenol in olive oil repair endothelial lining and boost nitric oxide. You have two mechanisms working together. One opens blood vessels from inside. The other relaxes muscles from outside. Together, they create a rush of blood flow many men feel within minutes. Not every man feels immediate response the first time. Some feel warmth, tingling, fullness within the first application. Others need a few sessions before tissue responds. But what's consistent is this: when you use this method regularly, 3 to 4 times per week, results build, blood flow improves, sensitivity increases, erections become stronger and more reliable. You're not forcing your body to do something unnatural. You're clearing the pathway and allowing your body to do what it was designed to do. All right, gentlemen. So now that you understand why this works, I'm going to walk you through the exact step-by-step method for preparing and applying this mixture so you can start tonight. And I want you to pay close attention because small details matter here. This isn't complicated, but precision makes the difference. Step 1. Gather your ingredients. You need 2 things. First, 1 teaspoon of extra virgin olive oil. Make sure it's cold-pressed, stored in a dark glass bottle, and as fresh as possible. The brands I recommend are California Olive Ranch, Kirkland Signature Organic, or Colavita. You can find these at any major grocery store. Second, 1/4 teaspoon of baking soda. Use pure sodium bicarbonate, aluminum-free if possible. Arm & Hammer pure baking soda or Bob's Red Mill both work perfectly. You probably already have this in your kitchen. Step 2. Prepare the mixture. In a small bowl, combine the 1 teaspoon of olive oil with a 1/4 teaspoon of baking soda. Use a small spoon to mix them together until the baking soda is fully dissolved and you have a smooth, creamy paste. The consistency should be like a thick lotion, not runny, not clumpy. If it's too thick, add just 2 or 3 more drops of olive oil. If it's too thin, add a tiny pinch more baking soda. Once you have the right consistency, you can warm the mixture slightly by rubbing it between your palms. This is optional, but many men find that warming it makes the application more comfortable and seems to enhance absorption. Step 3. Prep the area. Before you apply anything, wash your penis thoroughly with warm water and a mild, unscented soap. Make sure you rinse completely. Then pat the area dry with a clean towel. You want the skin clean and dry so the mixture can absorb properly without any barrier. Step 4. Apply the mixture. Now, using clean fingers, scoop a small amount of the paste and begin applying it to your penis. Start at the base of the shaft and work your way upward toward the head. Use gentle circular motions, massaging the mixture into the skin. Pay special attention to the underside of the shaft, where the most sensitive nerve pathways are concentrated. Don't rush this. You're not just rubbing something on. You're activating the tissue, waking up the nerves, encouraging blood flow. Take your time. Massage for a full 2 to 3 minutes, covering the entire shaft evenly. Step 5. Let it sit. Once you've massaged the mixture in thoroughly, leave it on for 10 to 15 minutes. You can sit down, lie back, relax, whatever feels comfortable. During this time, many men report feeling a gentle warmth spreading through the tissue. Some feel a tingling sensation. Some notice a slight pulsing or a sense of fullness. All of these are good signs. It means blood is moving. If you don't feel anything the first time, don't worry. Sensitivity varies and the effects build over time. Step 6. Rinse and dry. After 10 to 15 minutes, rinse the area thoroughly with warm water. Not hot, just comfortably warm. Make sure you wash off all the residue. Then pat yourself dry gently with a clean towel. Don't rub aggressively, just pat. Step 7. frequency, and timing. For best results, use this method 3 to 4 times per week. I recommend Monday, Wednesday, Friday, and Sunday, but any consistent schedule works. The key is consistency. Don't skip sessions. The best time to do this is in the evening, ideally 30 to 60 minutes before bed. Why? Because testosterone production peaks during deep sleep, and you want to give your body every advantage. Applying this before bed means the ingredients can work overnight while your natural hormonal processes are at their strongest. The first few times you do this, you might feel a slight warmth or tingling, or you might feel nothing at all. Both are normal. Some men notice increased sensitivity within hours. Others need a week or two before they start feeling significant changes. What's important is that you stay consistent and trust the process. Your body is relearning how to respond. Give it time. Now, one of the most common questions I get is, how fast will I see results? And the honest answer is, it depends. Every man's body is different. Your age, your overall health, the medications you're taking, how long you've been struggling, all of these factors play a role. But I can give you a realistic timeline based on what I've seen in my practice over the past decade. In the first application of 0 to 24 hours, some men feel warmth and tingling during the first application. That's the blood flow activating. A smaller percentage, maybe 20 to 30%, actually wake up the next morning with a partial or even full morning erection. For them, it's almost immediate. But if that doesn't happen to you, don't panic. Most men need a few sessions before the tissue becomes responsive enough to show visible results. In the days 2 to 7 or by the end of the first week, most men report increased awareness of blood flow in the pelvic region. The area feels more alive, more responsive to touch. Some notice that arousal feels sharper, that the mental-physical connection is starting to strengthen. Again, morning erections may start returning, even if they're only partial at first. This is a good sign. It means the blood vessels are waking up. In the weeks 2 to 4 is where things really start to shift. The majority of men see noticeable improvements. Erections become stronger, firmer, more reliable. They last longer. Sensation becomes sharper. Morning erections become more frequent and more full. Confidence starts to return because your body is proving to you that it still works. One patient told me I didn't realize how much I'd been holding my breath until I could finally exhale again. That's what this phase feels like. Relief, hope, the beginning of reclaiming yourself. By the 2 to 3 month mark, most men who've been consistent with this method report that erections are strong, dependable, and natural. Intimacy becomes something to look forward to, again instead of something to fear. Relationships improve because the physical connection is back. Partners feel wanted. Men feel confident. The shame and frustration that once dominated every interaction start to fade. I've had patients tell me that their wives cried, not because they were sad, but because they finally had their husbands back. That's the power of restoring this function. It's not just about sex. It's about identity, connection, and feeling whole again. Now, I need to be honest with you. Not every man will experience the exact same timeline. Some see dramatic results in the first week. Others need a full month before noticing significant changes. Age matters. Health matters. Consistency matters most. If you do this once and give up, you won't see results. But if you commit to 3 to 4 times per week for at least a month, you're giving your body a real chance to heal. Beyond physical improvements, many men feel different emotionally, more confident, more present, more like the man they used to be. When your body starts working again, your mind follows. You stop avoiding intimacy. You stop making excuses. You start reaching for your partner again. But before you rush to try this, here are some critical safety warnings you should listen to very carefully, because not every man should use this method, and using it incorrectly can cause harm. I'm going to walk you through exactly who should avoid this and what warning signs to watch for. First, open wounds or skin damage. If you have any cuts, scrapes, rashes, irritation, or broken skin anywhere on your penis, do not apply this mixture. Wait until the skin is completely healed. Applying baking soda to damaged tissue can cause burning and worsen injury. Second, sensitive skin or known allergies. If you have sensitive skin or history of reactions, do a patch test first. Apply a small amount to the inside of the forearm. Wait 15 to 20 minutes. If you see redness, itching, or swelling, do not use this on your penis. If you have an allergy to sodium, bicarbonate, or olive oil, this method is not for you. Third, and this is critical, nitrate medications. If you're taking any nitrate-based medications for heart conditions, nitroglycerin, isosorbide mononitrate, or isosorbide dinitrate, you must consult your doctor before trying this. Nitrates relax blood vessels and lower blood pressure. This mixture also promotes blood vessel dilation. When you combine the two, you risk a dangerous blood pressure drop that can lead to dizziness, fainting, or medical emergency. I've seen men end up in the ER because they ignored this warning. If you're on nitrates, talk to your cardiologist first. Fourth, active infections. If you have any urinary tract infection, sexually transmitted infection, or active infection in the genital area, stop. Do not use this until infection is fully treated and cleared. If you experience severe burning, pain, intense redness that doesn't fade, or swelling beyond normal engorgement, rinse immediately with cool water and stop. Mild warmth and tingling are normal. Pain is not. If your erectile dysfunction is sudden, complete, or accompanied by chest pain, shortness of breath, or severe fatigue, see a doctor immediately. Erectile dysfunction can be an early warning sign of cardiovascular disease. Your safety matters more than any result. Be smart. Be cautious. Now let me share a story that shows what's possible when you do this right. A few months ago, a 71-year-old man, let's call him Robert, walked into my office. Married 40 years, retired contractor, raised 3 children. For 3 years, he hadn't been able to get in. Erection. Nothing. He tried medications. Viagra gave him splitting headaches and didn't work. Cialis made him dizzy. His doctor said accept it, it's just age. But every night, lying next to his wife, he felt like he was failing her. The silence between them had grown suffocating. I taught him this exact method. 1 teaspoon olive oil, 1/4 teaspoon baking soda, 3 times weekly before bed. He was skeptical but willing to try. Week 1, warmth and tingling during application, but no erection. He almost gave up. I told him to keep going. Week 2, he woke with a partial erection, the first in over 2 years. He called me that afternoon, emotion in his voice. Week 3, full morning erection. By month's end, he and his wife were intimate again. When he came back, he looked like a different man. He told me, Dr. Romano, I got myself back. I didn't think it was possible at 71. Then he said, my wife told me she didn't realize how much she'd missed me until she had me again. That's what this is about. Not just erections. Identity. Connection. Feeling like yourself. If a 71-year-old man who tried everything could restore function in less than a month, imagine what's possible for you. If you found this information helpful, do me a favor. Subscribe to this channel and hit the notification bell so you don't miss the next video. I'm creating content specifically for men over 50 who refuse to accept decline as inevitable. Now type yes in the comments if you're going to try this tonight. Type your age and how long you've been struggling. Let's support each other. You're not alone in this. I am Dr. Lila Romano, and I'll see you in the next video.